Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving.
Today we're talking with Dr. Hector Dourron, a board-certified, fellowship-trained vascular surgeon with Hamilton Vascular Center. Dr. Dourron, welcome to the show.
Thank you. Thanks for having me.
Today we're going to talk about chronic venous insufficiency, a condition that affects millions but is often misunderstood. We're going to learn what venous insufficiency is, what causes it, and how it's treated. Well, Dr. Dourron, what exactly is this venous insufficiency?
So venous insufficiency is a term that we use to encompass a lot of different conditions that have to do with the veins. So in other words, there are people who have tiny telangiectasias, which are like little spider veins on their feet. There's people that have big ropey veins on their feet or legs. There's people that ultimately even can get ulcers on their legs. And then there's also a component of it that is just swelling and an achiness and tiredness feeling in your leg, restlessness in your leg. And all of those conditions we have now come to find out that are all related to the same thing, which is venous insufficiency. So venous insufficiency is actually a hereditary problem. It is something that you are born with. It runs in your family. If your mom or your dad have it, perhaps a grandmother or grandfather have it, then they can pass it on to you. You pass it on to your kids. It's the gift that keeps giving. It can get worse by certain work conditions, being standing on your feet for long periods of time. That's why we see it oftentimes in nurses, factory workers, people that work on concrete floors often come in and say, I work on a concrete floor, and that's why I have this. Well, in actuality, they got the venous insufficiency from their parents. It may be exacerbated or gotten worse by their work conditions or the fact that they're standing on their feet all the time. But, just know that it is a hereditary condition.
Going into this, I wasn't aware of what it was called, but I have seen this in many different people.
Yeah.
And you mentioned some of the symptoms. Are there super major symptoms that come from this?
So leg swelling is the one that we, or that most people focus on primarily, So you wake up in the morning, your ankles are as small as they're going to be all day long. And then after you've been on your feet all day long for your job or, working, by the time you get home at night, your ankles are more swollen. Oftentimes that swelling is not, it doesn't have to be massive. So in other words, people just take their socks off and you see an indentation of your sock on your leg. Well, that's swelling. And what happens is that with that swelling, in the lower leg in particular, there isn't a whole lot of room for all that extra fluid. And so when you have swelling, that leads to inflammation of the nerves that run right alongside those veins. And so swelling equates or, equals symptoms, because then that irritates the nerves, that you have inflammation of the nerves. And then that's why generally people who have chronic venous insufficiency, and we call it chronic venous insufficiency because this is something, like I said, you're born with. So you're going to have it all your life. There is no cure for it. And so there are solutions for it. There's treatments for it. And we'll talk about that in just a minute. But know that this is a chronic disease. And so the symptoms that you get are primarily towards the end of the day or at night after you've been on your feet all day long and you get that swelling. Another symptom that people oftentimes will see is discoloration. They see kind of a bluish hue of their lower legs, and it's because of what we call venous pooling. So in other words, arteries are supposed to take the arterial blood, the oxygenated blood, down towards your feet, and then your veins are what bring the blood back up towards your heart, back up towards your lungs so it can get reoxygenated and then circle around again. What's happening is, like a venous insufficiency is a vein problem, okay? And so within a vein, there are these little valves, and it's a one-way valve. And so in other words, every time your heart beats, blood goes through this valve, and then it opens up the valve, and then the valve is supposed to shut with every heartbeat. And so therefore, that venous blood, which is now it's a darker color because all of the oxygen has been taken out of it from the tissues, is steadfastly moving up the vein back up from your feet towards your heart in order so that it can go through your lungs, get reoxygenated, turn red again, and then circle back around. Well, what happens is in venous insufficiency, you are born with these veins that are slightly larger than they should be. These valves are what we call incompetent, meaning that they don't close completely. And so what happens is that you have this blood that cannot leave your feet. If you're standing on your feet, your heart is where the blood's trying to get to. Well, that's much higher than your feet. And so the difference in pressure between the blood at your heart level and the blood at your feet level makes it so that that blood has a hard time getting back up towards your heart if you don't have those one-way valves. When that blood stays in your feet for longer periods of time, then more oxygen gets taken out of it. It turns bluer. And so that's why people oftentimes will see a bluish discoloration of their feet. And all it is just what we call venous congestion. It's that venous blood that's just pooling in your lower legs.
You know, I've never thought about this being passed down in a family, you know, like from person to person. So this is just not something that you just get one day, like you're born with this.
So, it's funny. So oftentimes people will tell me, you know, no, I don't, you know, I've seen my mom and dad and they don't have it. And so it can skip generations. Is one thing. So it can go from a grandmother to a granddaughter and skip the mom. However, what generally tends to happen is that people will have varying degrees of venous insufficiency. So it all falls under the same umbrella. So it all is part of the same condition. However, there are different degrees of it. And then the other point is, work conditions do have to do with it. So in other words, a nurse who's on her feet all day long and doesn't wear compression stockings, which is part of the treatment that we'll talk about later, she is more likely to develop signs and symptoms of venous insufficiency earlier in her life than, let's say, her mom who, had a job where she didn't have to be on her feet all the time. So work condition definitely can accelerate the signs and symptoms.
How does this actually get diagnosed once they see the signs?
People who generally have those kind of symptoms, so like I said, restlessness in their legs, swelling, discoloration, those kinds of things are generally referred to us for evaluation. We oftentimes can just look at someone's legs and determine that they have venous insufficiency. And then at that point, the treatment consists of compression stockings. So compression stockings is the number one and only treatment for venous insufficiency as a general term, okay? And so compression stockings, what they are is they're called graduated compression stockings. They are specially designed socks. They're not diabetic socks. They're not, some of these other socks that you can get on the market. However, a lot of places are now starting to sell them. So you do see them more often. You can buy them on Amazon. You can buy them. I think CopperFit has some of these graduated compression stockings now. And what they do is they are super tight stockings that squeeze more at the foot, a little bit less at the ankle, and a little bit less in the calf. And so in other words, it is a graduated compression. So where it is pushing that fluid back out of your lower leg and back up towards your thigh area where there is more space. These stockings are to be worn from the time you get up in the morning to the time you go to bed at night. And like I tell people, every day for the rest of your life. Okay. So once we diagnose you with chronic venous insufficiency, like I told you, this is not this isn't like getting an appendix, okay, appendicitis. Okay, you get appendicitis, you get diagnosed with appendicitis, they take out your appendix, guess what? You can never have appendicitis again. Yeah. That's not what this is. When you get diagnosed with chronic venous insufficiency, this is a chronic condition. So this is something you were born with, you're going to die with, and there is no cure for. There's a treatment, but there is no cure because it's hereditary. So by wearing these compression stockings, you alleviate the symptoms, you prevent the swelling from occurring. Okay, so these stockings are super, super tight. They do get some getting used to. Like I tell people, you are to wear them from the time you get up in the morning to the time you go to bed at night. However, your legs aren't going to fall off if you don't wear them one day. Okay, if you're going to go to the beach in them, don't wear them because you're going to look ridiculous. So within reason, the more you wear these stockings, the better you will be.
How serious could it get if left untreated? Is it like almost cosmetic, or is it like actually really serious?
So there is a cosmetic component to it. Having these veins that are prominent on their legs or discoloration in their legs is not what they want to see. So some of that is cosmetic. However, it also can be very serious. And so depending on how advanced your disease gets, people will have something called stasis dermatitis, which is, if you've ever seen people's legs where their shins are kind of a brownish bronze color. It literally is like a stain in the skin, and that's called stasis dermatitis, and that is a discoloration of the skin. What happens in those cases is that their veins are under so much pressure that the red blood cell is being pushed out of the vein. And so that red blood cell that gets deposited in the tissue gets metabolized by your tissue, and the pigment that's in the red blood cell is called hemosiderin. It's what makes the red blood cell red. That gets deposited in the skin. That deposit will never go away. And so those people that have that discoloration of their shins, the stasis dermatitis, they will have that for life. You can't make it better. Now, by treating the venous insufficiency with the compression stockings, we can arrest the progression. So in other words, it won't continue to get worse. However, what's already there is going to be there. And so those deposits within the skin also change the texture of the skin. And so the skin is a living, breathing organ. And by making by putting these deposits in there, it actually changes the texture of the skin. Well, when you change the texture of the skin, it becomes harder. Blood vessels are not as easily able to get blood to this portion of the tissue, and oftentimes people will develop ulcers. Venous ulcers that's a very difficult problem, because once a person has progressed in their venous insufficiency to the level where they are getting venous stasis ulcers, despite wearing their stockings, 20% of people will develop repeated ulcers, even if they wore their stockings every single day. So in other words, their skin has changed to the point to where they're going to develop these ulcers. Now, these ulcers are breakdown of the skin, so it is where your skin is basically fallen apart in that particular location, and your legs will start to weep water, like literally, because you have so much swelling in your legs that water will start coming out of your skin, and you'll wet your socks, and it's a big problem. This problem, if left untreated and ignored, can lead to amputation.
Oh my goodness!
So there are varying degrees, and that is obviously the extreme, but you can lose your leg from untreated, very bad venous insufficiency. So it ranges from cosmetic to that.
I think that wraps up today's episode of Health for Life. Thank you very much for joining and talking about this. I feel like a pretty common issue that people need to learn more about.
Oh, absolutely. Absolutely. You'd be surprised at how many people suffer from venous insufficiency that don't really recognize it. Just really quick, another point that I wanted to make. Oftentimes people will come into my office with restless leg syndrome, they call it. Yeah. So there is a medical condition called restless leg syndrome, and it has to do with nerves. However, this particular condition of venous insufficiency is oftentimes misdiagnosed as restless leg syndrome. And so in other words, people will tell me that they've been diagnosed for years with restless leg syndrome, and we take a look at their legs. We actually diagnose them with venous insufficiency. We put them in the proper treatment of compression stockings, and then all of a sudden their legs are better. And so it is oftentimes underdiagnosed, for sure.
If somebody wants to get into contact with you, what's the best way to reach out?
The Hamilton Vascular Center is where my partner and I, Dr. Hartley, and myself treat this. We have a vascular lab there where we do ultrasound tests. There are some ultrasounds that can be done in order to diagnose another component of venous insufficiency, and we do those there in the office, and we treat people, and we can get you in.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.